Yeah.
This is Professor Funnel again with a public service announcement. I'm here to warn you about the dangers to your health and society today. There are four main pathogens. Pathogen is a small microorganism that is capable of causing a disease. First, we're going to tell you about a pathogen called a fungus. It's kind of like a mushroom, and its name is athlete's foot. Athlete's foot is a common skin condition that affects the sole of the foot and the skin in between the toes with dry, red, itchy skin. This disease is usually caused by a fungal infection and can be contracted in public lockers, swimming pools, and areas where infected individuals have walked around barefooted. Athlete's foot can also be contracted in public showers, but in this case it can be prevented by urinating on the shower floor before you use it, because the ammonia in the urine kills the fungi and other bacteria. After using the shower, make sure to urinate on your own foot just in case. Depending on the stage of infection, doctors will prescribe various over-the-counter medicines, but the most common one for fighting fungi is known as Lotrimin. Next, we're going to talk about a protist called African sleeping sickness. It comes from Africa. African sleeping sickness is a disease native to infected areas of rural Africa. Shocker, right? Most commonly transmitted through the bite of infected flies, the disease comes in two stages. The first stage consists of fevers, headaches, itching, and joint pain, while the second stage consists of numbness, poor coordination, confusing, and difficulty sleeping. It can be cured by doses of pentamidine or suramin for the first stage, and a combination of ethylfluorine and nifurtimox for the second stage. This can be prevented by scanning the populace each year for symptoms of African sleeping sickness, and generally staying away from rural areas of Africa where this disease is common. Next, we're going to talk about a common bacteria known as tuberculosis. Tuberculosis is a lung disease that can be transmitted to the body when an infected individual breathes, coughs, or sneezes into the air. It can be prevented by keeping your body's immune system strong, and you should get tested for it once in a while. There's a vaccine that you can get to aid in preventing it. Here's a fun fact. Tuberculosis used to be called consumption due to the fact that it eats away at the body as the disease progresses. Now we're going to talk about a virus called HIV. HIV stands for Human Immunodeficiency Virus. It is a virus infamous for destroying the immune system and, without proper treatment, decreases the average life expectancy by about 10 years after the infection sets in. Many people believe that HIV is only contracted through sexual intercourse with an infected individual, but this is not the case. HIV is contracted through sharing blood with an infected individual, such as through a cut, dirty needles, blood transfusions, and even if one's biological parents had HIV during a delivery. There is no known cure for HIV, but scientists are still working on it. HIV can be prevented by using certain safety cautions around infected individuals, such as safety glasses, rubber gloves, long-sleeved clothing, and chastity belts. You should also be aware of your environment in ways such as being cautious around blood in case individuals are infected with HIV, and most importantly, don't be promiscuous. Well, that's all the time we have for today, public. This is Professor Funnel, putting the fun in science.